Welcome to the PharmSC clinic. As a volunteer, please arrive at 9:15 a.m. to check in with the clinic supervisor. All volunteers are expected to dress professionally and bring their lab coat. Don't forget to have your USC ID and/or name badge as well. You must bring your pharmacy intern license and competency or extra credit form. During check-in, your supervisor will go over the consent forms, where to enter patient data, and where the supplies are located. The consent forms are the same as the ones you will be using at health fairs. Now you are ready to begin. Introduce yourself and go over the patient consent form. Some things to remember before we begin. We do not diagnose, we only screen. The patient may or may not need to follow up with their primary care provider. Also, it is okay to not know the answer to any of the questions that the participant may ask you. That is what the clinic supervisor and preceptor is there for. Please do not guess or make up an answer. If your patient only speaks Spanish, don't worry. We have handy guides to help you. Ask which screening your patient would like done. We are able to screen blood glucose, cholesterol, hypertension, and conduct body fat analyses. To conduct a blood glucose screening, first ask your patient to rub their hands together to get blood flowing while you sanitize and put gloves on. Ask your patient which hand, then if they prefer being pricked on the middle or ring finger. Alcohol swab the finger you will be pricking. While the alcohol is drying, set up your glucose machine by inserting the test strip into the machine. It should turn on once the strip is inserted. Pick up a lancet and twist the bottom of it to open. With one hand supporting your patient, position the lancet on the side of the finger where there are less nerves. Firmly press down on the lancet to prick. Discard the lancet into the sharps container. Squeeze the finger to aid in blood flow. Collect the first drop of blood with the edge of the test strip. If you are only conducting a blood glucose screening, at this time while the machine is reading the sample, wipe off excess blood with a gauze and apply a Band-Aid to your patient. Discard anything containing bodily fluids into the biohazard bin. Then report the reading to your supervisor. To screen for cholesterol, you must first prick the patient with a lancet. Firmly wipe the first drop of blood with a cotton ball before collecting the blood with the capillary. Alternatively, you can start collecting blood into the capillary after a glucose screening. Point the black end of the capillary towards the patient's finger and start collecting the blood. Push down on the finger if you need to stimulate blood flow. Do not pull on the finger to milk the blood out. As the capillary fills, angle it downwards and continue to collect blood until you reach the black mark on the capillary. Once the capillary is full, place a cotton ball on the prick and ask your patient to hold it down as you set up the cholesterol machine. The machine will prompt you to put in the blood sample. Insert the plunger into the red end of the capillary and push down to carefully expel the blood onto the test strip. The machine will take a couple of minutes to process. At this time, place a Band-Aid on your patient. A beep will signal that your readings are ready. Report your readings to the clinic supervisor. Discard the lancets and capillaries into the sharps container. Discard all other supplies that were in contact with patient's blood into the biohazard bin. To conduct the blood pressure reading, first wrap the cuff over the brachial artery and have the bottom edge of the cuff about 1 inch above the elbow. Before you begin pumping the cuff, make sure that the patient is sitting in an upright position with both feet placed firmly on the floor. Place the head of the stethoscope over the brachial artery. Using the palpatory method, estimate the patient's systolic blood pressure. After estimating the systolic blood pressure, make sure to remove the cuff and deflate it before placing it back onto your patient to conduct the actual blood pressure reading. Inflate the cuff to the level determined earlier by the palpatory method. Deflate the cuff at 2 millimeters of mercury per second while listening for heart sounds. The first sound is the systolic pressure, and the last sound heard is the diastolic pressure. If you feel you have to repeat a reading, wait a couple of minutes before doing a second reading. Once the readings are ready, report them to your supervisor. To conduct body fat analysis, first take your patient's weight and height. To take your patient's weight, first zero the scale by sliding the weights to the far left. Make sure your patient has emptied their pockets. Have the patient step onto the scale. Then slide the weights to the right until the bar is balanced. Tell the supervisor the weight to record the value. Next, have your patient remain on the scale, then turn to face away from the balance bar. Slide the ruler attached to the scale up, then lift the headpiece, and slide the ruler back down until the headpiece touches your patient's head. Have the patient step down from the scale and take a seat. Read the height and report it to your supervisor to record the value. Set up the machine by inputting their age, height, and weight. Make sure your patient's hands are dry. Then have your patient hold the machine at arm's length in front of them. Position the hands so thumbs point upward and the middle finger in the depression. Press start for your patient. Report the readings to your supervisor. Remember, you cannot screen pregnant women or patients with pacemakers or other implanted electronic devices. Once you have completed the screenings requested by the patient, you may now begin counseling. At this time, the clinic supervisor will print out a screening value sheet for your patient. You may use that to counsel the patient according to his or her values. For Spanish-speaking patients, we have Spanish handouts available for your reference. In addition to the screening's value sheet, we also have handouts, booklets, and other information for your patient's education. PharmSC also has a list of free clinics which you can refer your patients to if necessary. Thank you for watching this video. We hope that it has been helpful and we look forward to seeing you in clinic.